Assalamu alaikum everyone, welcome back to my channel. This is Dr.Hajira and today I am going to talk about diabetes. The term diabetes commonly refers to diabetes mellitus, a metabolic disorder that leads to excess sugar or glucose in the blood. Glucose is the main source of energy for the body. Once food is digested, glucose enters blood and is carried to various cells and tissues. Elevated blood sugar levels follow and a meal causes the pancreas to release a hormone called insulin. Insulin helps glucose in the blood to enter the tissue cells where it is used to produce energy for different activities, plus bringing sugar levels in your blood down to normal. The normal range of blood glucose levels while fasting is 70 to 99 mm per deciliter. Increased levels of glucose in blood leads to diabetes mellitus. Causes: diabetes can occur if the pancreas is unable to produce insulin or if the cells are resistant to glucose. An increased amount of insulin requires for the cells to absorb glucose. There are two main types of diabetes. Type 1 diabetes is autoimmune disease where the body's immune system attacks the insulin-producing cells of the pancreas, resulting little or no insulin production. Type 1 is also called insulin-dependent diabetes or juvenile onset diabetes, as it is commonly seen in children. Type 2 diabetes is much more and occurs due to insulin resistance, may be associated with inactivity, obesity, and genetic factors. It is also called adult onset diabetes as it occurs mainly in adults, though it is becoming more common in children with the increase of childhood obesity. The other type of diabetes include prediabetes, where blood sugar levels are raised but are not high enough to be diagnosed as diabetes. This condition usually precedes type 2 diabetes. Gestational diabetes is a type of diabetes that may occur during pregnancy as hormones produced for the baby's growth and development block the action of insulin, raising the mother's blood sugar levels. Once the baby is born, blood sugar levels usually return to normal. Other risk factors for diabetes include increased age, ethnic background, high blood pressure. Signs and symptoms. Diabetes is often a silent disease. Symptoms may not appear until blood glucose level are significantly high over a long period of time. So if it is not unusual to have diabetes without being aware of it, common symptoms of diabetes include increased thirst, increased hunger, frequent urination, lack of energy, blurred vision, infections, weight loss. Complications. High blood sugar levels over prolonged duration can lead to complications of many organs in the body. Diabetes can damage blood vessels, causing poor circulation, which can lead to heart attack, stroke, kidney disease, damage to the retina in the eyes, nerve damage, or poor wound healing, gum disease, skin infections, and sexual dysfunction. Diagnosis. To make a diagnosis, your doctor review your symptoms and perform a physical examination, as symptoms usually appear later in the course of the disease. Screening is recommended for those with an increased risk of diabetes. This includes individuals over age of 45, those their body mass index greater than 25, and those who have history of gestational diabetes or prediabetes. Diabetes is mainly diagnosed by checking the level of sugar in your blood. A blood glucose test can be performed at a random time or after an overnight fast. Hemoglobin A1C test checks the amount of the sugar attached to hemoglobin, the oxygen-carrying protein in the blood cells. The glucose tolerance test involves testing blood sugar after an overnight fast and then periodically after drinking a sugar liquid. Type 1 diabetes may be diagnosed with the urine test for ketones. Test may also perform if your immune system is producing antibodies against the insulin-producing cells in your pancreas. Treatment. Treatment depends on the type and severity of your diabetes. Your doctor may recommend lifestyle changes or medications. Insulin along blood glucose monitoring, measurement of carbohydrate intake. Insulin is administered in the form of injections or with the insulin pump. You will be educated on the glucose monitoring, which may have to be performed several times in a day. Glucose levels can vary with physical activity, food, medications, illness, and stress. People who have received insulin must check insulins more often. Blood glucose usually monitored using finger stick, a blood glucose meter. Hemoglobin A1C tests are also recommended so that every blood sugar levels over a few months can be determined more accurately. Glucose monitoring device is also available. You will be advised to eat a healthy diet, watch your sugar intake. A dietitian can help you personalize diet plan based on your food choices and lifestyle. Exercise and physical activity are important as they lower blood sugar levels and insulin resistance. 30 minutes of aerobic activity a day is recommended. Diet and exercise can help you maintain a healthy weight, also helps in controlling diabetes. Those who are overly obese can benefit from bariatric surgery, which has been shown to reverse diabetes as a result of the associated weight loss. Pancreas surgery may be recommended for those with type 1 diabetes. Keeping gestational diabetes under control can help prevent complications during pregnancy and labor. Your doctor will monitor your glucose levels regularly and provide adequate treatment. Summary: affects the way your body uses glucose. High blood sugar levels can lead to various complications. Adequate treatment, preventing measures, and a healthy lifestyle helps most people improve the length and quality of their lives. Thank you so much for watching this video. Subscribe to my channel and stay tuned for the next video.